We might be chasing better care, yet losing something very essential. Emotional exhaustion are now so common. Cut physician burnout by more than 20%. Can machine understand the human side of healing? It's about the future of healthcare. Dr. Harvey Castro, better known around the world as Dr. GPT.
Honestly, it's thinking outside the box. How can we do things? And I know it sounds crazy. Within 5 minutes, I started writing the book.
In an era where healthcare is evolving faster than ever, where smartphone monitors our heart rate algorithms predict our next illnesses and doctors are sprinting to keep up with it all, we might be chasing better care, yet losing something very essential: the human heartbeat behind the system. In hospitals across the world, doctors are working harder than ever, not just to save lives, but to survive the system itself. Long shifts, endless work paper, emotional exhaustion are now so common that a major study found AI tools cut physician burnout by more than 20% in just 3 months, not because they replaced doctors, but because they gave them back what matters most: time to care. And there's the deeper truth emerging from global research. Most doctors aren't burned out from treating patients, they're burning out from treating paperwork. AI is beginning to change all that, allowing physicians to spend less time on screen and more time connecting with the human being in front of them. But even with all this innovation, a few studies reveal the biggest challenge isn't technology, it's trust. A study revealed that physicians trust workload, risk perception, and integration of AI into workflow are major factors in success of AI adoption. Doctors worry: can machine understand the human side of healing? Can we depend on code to make choices that carry real emotional weight? And are they gonna be replaced themselves? So today's episode isn't just about technology or medicine. It's about the future of healthcare and the people making sure that technology helps us and not replaces. Welcome to another episode of Khan Clinics. I'm your host, Dr. Amir Khan, and I'm honored today to be joined by one of the most insightful voices at this extraordinary junction in life, Dr. Harvey Castro, commonly Dr. Harvey Castro, better known around the world as Dr. GPT. He's a true game changer at the crossroads of medicine and technology, an emergency physician turned visionary AI strategist, an author, and a healthcare futurist. He's redefining what it means to heal in the age of artificial intelligence. He, the first author to explore how ChatGPT could help solve crimes, a global voice championing ethical, intelligent healthcare, and the creator of more than 30 groundbreaking medical apps that are transforming patient care and physician efficiency. His books include ChatGPT and Healthcare, The AI-Driven Entrepreneur, Bing Copilot, and other LLMs, and solving in famous cases with AI have inspired thousands worldwide to view medicine as smarter, faster, and more human. References to book. Dr. Castro, welcome to the show.
Thank you so much for having me, and thanks for your patience and flexibility. I really appreciate it, and I'm so excited about our time today. So thank you.
We're looking forward to it immensely too. So let's start right with the first question. You faced immense challenges and still rose to become a physician, an entrepreneur, and now an AI visionary. Yet, a physician dipping into the AI tech world is a rare combination and is not seen a lot. What inspired you to take this journey?
Yeah, such a good question. And just to give you a little background, My mother is a teenager, had me in New York City and had many, many obstacles. So that's kind of what he's referring to. And honestly, it's thinking outside the box. How can we do things? And that really got me to where I am today. And so, how did we get today to this AI in healthcare and me? Well, being a physician for an emergency room for about 20 years, combining the entrepreneurship, I've done over 40 companies and helped take companies public. And then literally, I was in this office and ChatGPT Healthcare literally came up in the sense that I was playing on the computer. It just happened to be released that day. OpenAI released ChatGPT, November 20, year 2022. And within 5 minutes, I thought, oh my gosh, had I had this tool throughout my career, it would have made things so much better. And I know it sounds crazy. Within 5 minutes, I started writing the book. And 3 weeks later, I published ChatGPT in healthcare. And it's just my way, simply a public service announcement. At the end of the day, it was nothing more than that. I thought, okay, I just want to help my fellow doctors, inspire them to look at this tool ahead of the curve. No idea that all of these things would happen. That literally, I ended up getting a call from the government of Singapore after they heard me speak, and now I'm an advisor for the country of Singapore, specifically the regulatory body for the Ministry of Health, and we do all this fun stuff with AI in healthcare.
Excellent. What a remarkable journey we've just experienced together. The path to health isn't always straight, but it's always worth the effort. I hope today's conversation inspired you to take the next step in your wellness journey, armed with new knowledge and a fresh perspective. If today's episode left you inspired, share it with people, someone who need to hear this. Give us a thumbs up and your opinion. Keep exploring, keep evolving, and we'll see you in the next episode of Khan Clinics.